Welcome to the early edition of my Ask Me Anything. So I have a meet up with a good friend later today that was a conflict with my usual 6 p.m. Central Time, so moving this up. So I appreciate you guys' flexibility. As always, we'll be back every Monday, 6 p.m. otherwise, but the archive for this one will be on my YouTube channel, drtwyman.tv, for those that normally expecting this at 6 p.m. So did get some good questions already, so I'll start answering these, and if any pop up in the comments, happy to answer those. The only other housekeeping I have today is that I did release the information about the retreat that I'll be doing at the Kangen Ranch in October, early November this year. There's a few people that had signed up for more email information, so they got some emails last week. I will then send out more information for those people in the near future. If you're still interested in this event, there's going to be openings. It's October 29th through November the 2nd at the Tucson Kangen Ranch location. There is some group pricing for people if they're interested. I'll put up a link in my story after this if people want to sign up for more information about it. So, time to answer those questions for you, help you be heart attack proof this week. So first question, what are my thoughts on the use of Urolithin A? Interesting compound, helps with mitochondrial mitogenesis, make new mitochondria, basically new engines. Pros, cons. Pros, mitochondria are the name of the game. The more energy you have, the better things work. Cons, cost of it. Generally, it's over $100 a month. And I tell people there's two supplement budgets I have. There's how many pills are they willing to take per day, and there's what are they willing to spend per day. So is it needed for all people? No, but if you have an issue with your heart or brain and need more mitochondria, it may be a good use. It's also good for people who are very athletic and when they kind of get an edge on things, maybe for those individuals if price isn't a concern. Can I explain what INOCA is? It's ischemia with no obstructive coronary artery disease. So the way I would look at it is more that it's endothelial dysfunction, something going on with the endothelial Glycocalyx, which lines the arteries. So this was a thing that always bothered me when I was still an invasive cardiologist many years ago, is that patients would show up with chest pain. Sometimes would have positive cardiac enzymes, indicating they were having a heart attack. We'd take them to the cath lab, we'd shoot the coronary arteries, and we wouldn't find any severe blockages. So no stents, no surgeries performed. And sometimes we tell them like, well, we don't know why you had chest pain or why this happened. So here's your blood pressure medicine, your aspirin, your statin, say good luck. But in hindsight, what they were having was microvascular disease. The lining of the arteries aren't releasing nitric oxide efficiently, and that's why they're having the classical angina type symptoms. More common in women. So if you have symptoms, don't dismiss them. Just because you don't need a stent doesn't mean you don't need aggressive treatment for your cardiovascular risk factors. Is diabetes linked to cardiovascular disease? Absolutely. It's one of the top things that damages the endothelial Glycocalyx, which lines the arteries. High blood sugar is toxic to the carbohydrate layer, which is the Glycocalyx. So highly linked, particularly people who have high insulin levels tend to have more vascular disease. How do you promote and increase the production of nitric oxide? So first is try to find out if there's anything that's damaging your production. So if you're using mouthwash and destroying the oral microbiome, try to stop doing that if it's okay with your treating providers. If you're on acid blocking medications, proton pump inhibitors particularly, unless you have an active ulcer or H. pylori infection, try to minimize the use case of those so that you have stomach acid to break down nitrates that are coming in through your diet. Then it's about optimizing nitric oxide. So exercise is one of the best ways, as blood flows across the Glycocalyx, that shear stress releases nitric oxide. UVA sun exposure, when UVA hits your skin, the nitric oxide is liberated from the dermal pools. And then green leafy vegetables that have nitrates in them, the oral microbiome breaks it down into things that ultimately become nitric oxide. If you can't get that under control, you can do biomarkers and look, do you have high uric acid, high homocysteine, high asymmetric dimethylarginine, start fixing those things. The previous question, if you have insulin resistance or diabetes, fix that because that damages the pathways that allow your body to make nitric oxide. But there are supplements, lozenges, and capsules that can improve nitric oxide. But work with somebody who knows which brands are better than others if you're not currently working with me. What are my thoughts on Kangen water filters? No particular opinion, pro or con. Do you need to drink structured water? Not necessarily. It's much more about how the body structures the water internally than the water that you're drinking through your gastrointestinal system. So the water gets structured when the infrared and the later UV light hits the surfaces. The water separates into electrons and protons. So the structuring of the water in your surfaces is more important than the way the water comes in. That being said, you do need electrolytes in your water. So if you're doing reverse osmosis and stripping out everything, you got to add some minerals back so that it can be structured. You can structure the water by vortexing it. You can structure it by putting it out in the light. And then there are different devices that may structure it. So no necessarily harm in doing it, but I don't think it's necessary for most people. Best test for overall heart health. Scan or MRI? It's one of the cases where there's not one test that rules them all. You have 60,000 miles of blood vessels. Often, if you have plaque in one vascular bed, you'll have it in others. So in our practice, we start head to toe. We do carotid intimal medial thickness scans to look for plaque in the carotid arteries. We look at plaque in the coronary arteries with either a CT coronary calcium score or a CT coronary angiogram, often with clearly AI analysis to look for soft plaque. We look for abdominal aortic aneurysms with ultrasounds. We look for peripheral arterial disease with ankle brachial index scans. Cardiac MRIs are generally not indicated as a screening test. It's more if somebody has a cardiomyopathy, a weak heart, or myocarditis, infection of the heart. So not one test to rule them all, but if you had to do something to look at your coronaries, probably a CT coronary calcium score. But endothelial testing is probably where I would actually start. So an endopat, looking at how well your arteries release nitric oxide. This is one where, off the top of my head, I'm not going to know this number. I always kind of defer to the graphs that DexFit has, but what would be considered an excellent VO2 max in someone's mid-60s. If you listen to Peter Attia, you generally want to be in the excellent category for at least a decade lower than you. So looking at the graphs of people in their 40s and 50s and seeing what their excellent values would be. But if your VO2 max is in the 55 and above values, you're doing pretty well for yourself. How much can one improve it? Well, the way to think about a VO2 max is it's similar to like a hemoglobin A1C. It's going to integrate all your exercise over time. And you can't luck your way into a higher VO2 max. It's years and years of volume that can get it up there. So lots of zone 2 to build the base, and then some interval training to get the peak of the VO2 max up. But it is a trainable number. Best vitamins to protect the glycocalyx. There is a supplement called Artery that has antioxidants in and also has glycosaminoglycans that help to regenerate the glycocalyx. So that's typically what I utilize for patients who have a dysfunctional glycocalyx or endothelial dysfunction. But omega-3s might have an effect on it. Probably where I would start. Looking for a question here. Recommendations for strengthening the heart. So I'll take it as a question as a general strengthening. Just aerobic fitness would be good. So zone 2 training is where I would start. Zone 2 is when you're at a 5 out of 10 perceived exertion scale. 10 out of 10, you're sprinting for your life. Not going to go more than 30 seconds. 5 out of 10, you could do it all day. Should be able to hold a conversation with somebody, so you shouldn't be out of breath at this activity. Should be about 60% of your maximal heart rate, and something where you could do it all day long if you had to. May not want to, but could do, and generally doing it for somewhere 30 to 60 minutes. more days of the week than not. 3 to 4 hours a week would be a good goal. Now, if you're saying how to strengthen the heart because you have a cardiomyopathy, different question. So you'd have to use all the guideline approved drugs, so beta blockers, ACE inhibitors, spironolactone, probably an SGLT2 inhibitor like Farxiga. And then you could do other things that support mitochondrial function, like Dr. Samatra's awesome foursome. You can do all the quantum biology things, grounding. You can do photobiomodulation. You can do sauna therapy. So a lot of things you can do to strengthen the heart. But first, you have to figure out, okay, what's weakening the heart. So if it's high blood pressure, treat the high blood pressure. If it's ischemic heart disease, treat the things that are causing the plaque in the arteries. Short and sweet. I think we're going to do it 15 minutes today, guys. So appreciate you guys' ability to jump on here a little bit earlier today, going out with that good friend a little bit later to catch up. But I'll be back next Monday, 6 p.m. Central Time. The archive for this will be in my stories for the next day. And then, as always, on my YouTube channel, drtwyman.tv. The Canyon Ranch retreat will be going on October 29th through November 2nd. So if you're potentially interested in hanging out with me in Tucson, going on some hikes, you can have breakfast with me if you like, and do your own thing for the rest of the day. So it's not really overly structured. But if you're interested in that, if you go to my website, it's drtwyman.com/retreat. There's a sign-up form where you just get some more information from me about what you're interested in learning about, and then I can send you more details if you're interested in how to book. So hope you guys have a great day, and I'll see you back next Monday.